Yeah. All right. Welcome, everybody. Welcome. My name's Dr. Joe McGurr, Dr. Joe, and thank you, everybody, for attending today. I'll begin by acknowledging the traditional custodians of the countries here, the Gadigal people of the Eora Nation, but also acknowledge that the traditional custodians of lands throughout remote, rural and regional New South Wales. And look, it's just absolutely fantastic. So many of you have been able to get here today. We've had 50 organisations sign up to the Rural Health Action Plan, and so many of you have made the effort to come here today, and I want to thank you. Today is an opportunity for our organisations to come together and with our MPs and in the Parliament make it very clear to the government that more needs to be done to improve remote, rural and regional health. Yes, efforts have been made. We've had inquiries and follow-ups to those inquiries, but it's very clear, much, much more needs to be done. And it's very clear that health is a key issue in remote, rural and regional communities. It's important for the health of our communities. It's important for the health and well-being of our families. Maternity services in particular are critical for the well-being of families and mothers. But on top of that, health services are critical for the economic well-being of rural and regional communities. And that's a message that has come through loud and clear when I've been visiting different parts of the state. It is about health, but it's also about future. It's about the growth. It's about remote, rural and regional New South Wales doing as well as it can. So that's why we have the Rural Health Action Plan, an advocacy plan with 6 points to it. And today we've got an opportunity to talk about that. We've got 3 speakers. No, actually, we've got 4 people to speak here today, and followed by which I think Sarah Mitchell will be saying some words. She's in the LC at the moment. I think they've got question time. And I'm hoping that the Minister will also pop in towards the end of the event. And what we wanted to do today was just briefly, and I anticipate this will go for approximately half an hour, just speak through from the voices of people at the coalface, speak to the Parliament about what is happening in rural health and how important it is to improve those services. So, on that note, I'm going to hand over to our first speaker, Danica Lees, CEO of the CWA of New South Wales. Danica, welcome. Thank you for coming today, and thank you for the support of the CWA. Thank you for what the CWA does in so many parts of the state for women and their families, but also for health services. Danica, I'll hand over to you. Thank you.
Thank you, Dr. Joe, and sincere thanks for having us here today and giving us this opportunity to talk about what CWA works on in terms of our advocacy points around health and why we so wholeheartedly support this plan as well. The Country Women's Association in New South Wales, we represent over 8,000 women across rural and regional New South Wales, and they are women who have watched year after year as the services that their communities depend on, and particularly health services, have quietly disappeared. So today I want to talk about the dangers of the normalisation of that, because that's what has happened here. Slowly, incrementally, over decades, we've been conditioned to accept less. Each closure, each roster cut has been absorbed, managed, explained away. And somewhere along the line, the unacceptable became the expected. And so that's how you end up circling the drain. Not all at once, but gradually and quietly, until one day you look up and realise that what you once would have called a health crisis has simply become the way things are. So we're here today to say enough is enough. It should not be normal to have a 24-hour emergency department left for hours because there is no doctor, and then when the doctor does arrive, it comes in the form of a computer on a trolley. We've heard the stories, we've seen the photos, and somehow we've kept absorbing it. That's not healthcare. That is a system that has learned it can get away with it because we've let it. It should not be normal for women to risk their lives and the lives of their babies on the side of the road because the nearest maternity unit has closed and the next town is an hour away, if you're lucky, and labour doesn't wait. When birthing units started closing, we were told it was a temporary measure, a pragmatic solution. We normalised it. And now women in our communities plan their births around logistics that city women would find unfathomable. It should not be normal to wait 3 weeks or more to see a GP, for a skin cancer check, for a child with a fever, for someone who's not coping. In our survey of over 800 rural and regional residents conducted 5 years ago at the time of the Rural Health Inquiry, more than 75% of those responding reported significant wait times for locally available services. Many waited months, many waited over 18 months, and that became normalised as well. And something else that we need to stop normalising, and something that doesn't get said loudly enough, the health professionals who show up every single day in our rural communities are extraordinary people. They are skilled, they are committed, and they genuinely care. Our rural nurses, our GPs, our midwives, our allied health workers, many of them have chosen to build their lives in these communities, to raise their families in these areas and to be part of the fabric of these towns. They deserve our profound respect and our gratitude. But we need to be honest about what we are asking them to do a lot of the time. We're asking them to work in facilities that in some cases would not look out of place in a developing country. Ageing infrastructure, equipment that belongs in a museum, rosters so thin that a single resignation can leave an entire community without a service. We're asking them to carry workloads that would bring most people to their knees, and then we are surprised when they burn out, when they leave, and when we can't recruit more. We have normalised appalling working conditions for the very people holding this system together with their bare hands. Normalise the incentivisation of out-of-towners to come in and fill the gaps while the basic working conditions of people committed to the regions languishes. And that has to stop, because when we fail to properly resource and support our rural health professionals, we are not just failing them, we are failing every patient who depends on them. The Legislative Council inquiry in 2022 handed down its 44 comprehensive recommendations. The coalition government was in government when that report landed, and they did not act with the urgency that it demanded. Then, in March 2023, New South Wales elected a Labor government. That government has now been in office for over 3 years. 3 years, and we're still here in this room having this conversation. Both sides of government have had their turn. Both sides of government have had the opportunity to act, and neither side has done enough. We're not really interested in whose fault it is historically. We are interested in who is going to fix it and when. Because here's what we've watched instead: a progress report that dresses up bureaucratic activities meeting the spirit of those 44 recommendations. Organisations like the Royal Flying Doctor Service who are now filling primary care gaps that no one else is filling, doing work far beyond emergency retrieval, remaining chronically underfunded for what they're actually doing on the ground. Again, the normalisation of a system that has learned to describe its failures as achievements. So at CWA, we refuse to normalise that any further, and that's why we were very keen when Dr. Joe approached us to jump on board with our wholehearted support for the Rural Health Action Plan. We think this plan offers a genuine pathway forward, not just another review, another working group, but actual practical reform built on recommendations that actually already exist. A GP in every town, permanent local staff instead of a $270 million locum revolving door, safe local maternity care, real community voice, and an independent rural health commissioner with actual teeth. The data exists, the inquiries have all been done, the recommendations are there, the workforce is there, exhausted, understaffed, but they are there and they're still showing up. What's missing is the political will to stop normalising the crisis and start fixing it. Our members and the communities that they live in are not second-class citizens. They deserve the same access to healthcare as any person in this country, regardless of the postcode on their front gate. We support this plan, and we call on this and any future government to act and support this plan also. Thank you, Dr. Joe.
Thanks so much, Danica. That was fantastic. Can I, before I introduce the next speaker, Roy Butler, the member for Barwon, can I just acknowledge there are a number of members of Parliament here today, and I just want to acknowledge them, starting with the Minister. Thank you very much for coming. We've got also the member for Lismore, Janelle Saffin, and also a Minister, member for Orange, Wakehurst, Albury, Campbelltown, Pittwater, Murray, and Goulburn, Port Macquarie, yes, okay. And there'll be others coming as well, and also Dr. Con from the LC is here. She may have to leave us for work in the LC, and I think Sarah Mitchell's just joined us as well. I'm just going to hand over now to the member for Barwon, Roy Butler. Roy was very kind enough to take me on a tour of his electorate. Well, actually, it took 3 days and it was just a tiny part of his electorate. But anyway, it was memorable. And it really served to emphasise how important health services are to communities and his strong advocacy. So I just wanted him to say a few words here from the front line. Thanks, Roy.
Thanks, Dr. Joe. So that short trip that we did, it was only a short trip, started on the 1st of March. I picked Joe up at Dubbo Airport, went out through Coonabarabran, out to Weewar, then across to Walgett. From Walgett, I think we went to Burke. From Burke over to Cobar to Wilcannia, and Wilcannia into Broken Hill. So you've still only seen that much of the electorate. Look, I've supported Joe's plan, and look, hearing Danica speak about Country Women's Association's view, sometimes I think we should just outsource policy to other groups. I want to acknowledge that the Health Minister, Ryan Park, who's in the room, has done incredible work to support regional facilities, in particular in my electorate, Weewar. Weewar was subject to a reduction in hours due to staffing availability, and Ryan has agreed to an independent review which has been completed. That led to an implementation plan which has seen the staff numbers growing as a result of a number of steps that were taken by Ryan and the LHD. So acknowledge that, and I really want to thank him for being here as well. Health is incredibly important across regional New South Wales. Now, Joe's plan, I've been a supporter of Joe's plan since the beginning. It is a simplistic plan. It's a high-level plan, but the essence of it and what we're talking about is having more localised services, less fly-in, fly-out, having people that are connected to communities. That's what's really important here. If we have people that are invested in communities and part of those communities, they will want to look after them. So in terms of my 27 hospitals and MPSs across the Barwon electorate, there's only 2 that have maternity services. I would love to think that we could hit a point in the future where more women could give birth closer to home, especially for non-complicated pregnancies. So certainly I've been a supporter from the beginning. I'll continue to be a supporter of Joe's plan, and I'm happy to work with Joe and the government in order to try and bring about some of this stuff. My electorate, as most of you would know, is 44.5% of the state, takes in over 150 communities and localities, and like I said, 27 hospitals and MPSs. All of them, one way or another, have staffing issues at the moment. So that's a universal problem, not just within Australia, but across the world, finding qualified people to put into facilities to keep them open. So we want to see an increase, an improvement in regional health, and that's only going to happen through change. If we keep doing the same thing, we're going to keep getting the same outcome. And I know I'll have a chat with Ryan as the Minister. I know I spoke with the RDA this morning. That's not Writing for the Disabled, nor Regional Development Australia. That's the Rural Doctors Association, in regards to how we could maybe structure regional health so that it works a bit better in incentivising people actually doing more within their local health facility. So that's what I'd like to see happen. We'll have a chat about that, I'm sure. I'm not blindsiding the Minister with that right now. But I want to thank you all for being here and acknowledging the importance of regional health. We know that the further west you go, the lower life expectancy you have and the worse health outcomes we have in terms of preventable deaths. So it's an area we can make improvement in, a lot of improvement. I know the Minister's committed to making improvement. He has been since day one. And I think together we can probably bring that about. But thank you very much, everyone.
Thanks so much, Roy. And I think it is important. What we're trying to do here is build a bipartisan consensus that will put pressure on the system to lift its game with rural health, and that's part of what we're doing. That's why this campaign's been running now for almost a year. We started in September last year, so And we're still going strong, and we want to make a big impact coming up to the upcoming election. Our next speaker is Jen Laurie from Her Herd, and I first met Jen, I think, at the Bush Summit in Wagga in August last year, and I was very impressed with Jen's advocacy. Can I just say at the outset that there are a number of organisations here who are concerned about maternity services, obviously the CWA, but we also have representatives here from Better Births Illawarra, from the Maternity Consumer Network, who've done such tremendous work, particularly in terms of birth trauma, and from the Miracle Babies Foundation as well. So I just want to acknowledge those groups in the room here. But Jen, thank you so much for coming along and saying a few words on behalf of the people that you represent. And I'll hand over to you. Thank you.
Okay, this is not my usual day. My name is Jen Laurie and I am a perinatal social worker, a mother and founder of Her Herd Australia, and more importantly, a proud rural woman. Several years ago, we started what became the Bush Babies campaign and the Her Herd podcast with a very simple goal. We wanted to listen. We wanted to create a space when rural women and families could tell the truth about their experiences of pregnancy, birth and parenting. What happened next surprised us. The stories kept coming. The stories of distance and disconnection, stories of simply no maternity services. But alongside these stories came something else, solutions. Women sharing accommodation options or addresses in regional hubs that they could use as workarounds. Families sharing travel advice or how to fill out IPTAS forms. Women sharing apps that find you wherever you are, no matter the emergency or no matter how far you are from service. Communities helping communities. Without ever intending to, Her Herd became more than a storytelling platform. It became a resource itself. A place where rural women could learn and from one another and share practical solutions to challenges they never knew they had until they became pregnant themselves. And while I'm incredibly proud of that, I think we should also ask ourselves why it became necessary in the first place. At Her Herd, we hear the stories behind the statistics, which are devastating. Rural Australia are now missing out on more than $8.3 billion in healthcare funding, and that's around about $1,000 shortfall per person in comparison to their metropolitan sisters. In some parts of rural New South Wales, rates of babies born before arrival at hospitals have doubled, and in my neck of the woods, it's tripled. When babies are increasingly born on the roadside, highways and during transfers, that is simply not about a story of resilience, it is a story about access and equity. We hear about women relocating hundreds of kilometres from home weeks before birth. We hear about women spending hours travelling while in labour or racing in an ambulance, having their husbands told, "Don't try and keep up, it's unsafe." We hear about mothers arriving at hospitals seeking care and being placed in rooms never intended to be maternity because facilities are overwhelmed, and FIFO workers expressing frustration with archaic equipment. And we hear about babies whose place of birth is listed as a highway or a rest stop in their birth certificates. Think about that for a moment. When babies are increasingly being born on highways during transfers and far from the intended place of birth, that's not a story of resilience. This is a story of access. At the Bush Summit last year, Premier Chris Mimms said he doesn't know how to fix rural maternity services and that he needs more time. And honestly, I can understand that. This is a complex issue. But I would respectfully say this. The woman who is 38 weeks pregnant facing a bypass doesn't feel like she has more time. The family being told to relocate doesn't feel like they have more time. The mother who almost died due to missed pathology services doesn't feel like she had more time either. The community watching another service disappear doesn't feel like they do either. Because while we continue to discuss solutions, rural families are living these consequences. And honestly, I often wonder what the consequence needs before action will be meaningfully taken. What concerns many of us is these changes continue to be presented as for our safety. And rural communities are increasingly asking, how is it more safe? How is it safer when more than half the women we speak to are expected to transport themselves? Not in an ambulance, not with clinical support, themselves while pregnant, while managing other children, while navigating uncertainty about where they will ultimately give birth. Some of these distances in sheer kilometres are unfathomable, let alone the financial stress and the emotional consequences. How is it safer when a woman is separated from her family and support networks? How is it safer when uncertainty becomes normal? How is it safer when trusted, respected networks are already currently there and being undermined? The backup is now needing a backup. One of the great contradictions in maternity care is that we continue to express shock at the rates of birth trauma in this state while often ignoring the conditions that contribute to it. When information is unclear, when services are unpredictable, and when choices are removed rather than expanded, that the truth begins to break down. And trust is one of the most important foundations of healthcare. That is why today matters. Because the Rural Health Action Plan Alliance is not simply another advocacy group. It's a coalition of communities, which we can see from all the people here. Consumers, clinicians, and advocates who believe rural healthcare can be better. The Rural Health Action Plan provides a clear pathway forward. It recognises that people closest to the problem are often closest to the solution. The Premier has acknowledged this problem needs solving. Rural communities have spent years describing the problem, living the consequences, and developing solutions themselves. The Rural Health Action Plan offers a way forward. Perhaps it's time to listen. Before I finish, I wanted to acknowledge our rural health workforce, someone I'm proud to be a part of. Our midwives, our nurses, our doctors, our allied health professionals, these are the people holding health systems together, the people showing up day after day despite increasing pressure. To every member of our rural health workforce, thank you. And finally, I want to speak directly to rural people. There is something I have noticed about rural communities. When adversity arrives, we get on with it. When services disappear, we find alternatives. When systems fail us, we find workarounds, and there is often a nice little tie-up to the story of our adversity and rural resilience. About how country people have found a way, about how communities came together, and how, while this is the truth, I worry it comes at a cost, because we have become quiet in our resilience. We've become so good at adapting that sometimes our adaptation is mistaken for acceptance. It is not. The fact that rural people continue to find solutions does not mean that the problem has been solved. Now is not the time to be quiet. Now is the time to speak up. Do it for the long-term sustainability of your communities. Because if there's one thing I have learnt from the thousands of women and families who have trusted her herd with their stories, it is this. Rural people are not asking to be rescued, they are asking to be heard. Thank you.
Thanks so much, Jen, for that passionate and eloquent statement of the issue, particularly in regard to maternity services. I just also want to acknowledge the health providers in our rural health service who do so much. Acknowledge Jodie Goff, who's here from the New South Wales Nurses Midwives Association. Thank you very much. Can also acknowledge local government New South Wales, who have paid me the ultimate compliment, coming with their own 6-point rural health action plan, which is fantastic. And I was privileged to be at the launch of that at their conference about 3 weeks ago. And Steve Krieg is here, as well as Damien Thomas and other members of council and local government who are here. But our next speaker is Dr. Rachel Christmas from the Rural Doctors Association. Dr. Christmas has been an outstanding advocate for rural health services since I've known her, since she's come to our part of the world. She knows what it's like at the front line. And she's here today with Dr. Ian Kammerman and Dr. Alam Youssef, who both have practiced for many, many years in rural communities and who have made an enormous difference to those communities, not just because they've worked as clinicians, but because they've been strong advocates as well within the system, and I just want to acknowledge that. But on that note, Dr. Christmas, Rachel, thank you very much for saying a few words.
Thank you, Joe, and thank you for the opportunity to come and speak with you today. And as representing the Rural Doctors Association of New South Wales, we'd like to lend our support to your 6-point plan, the Rural Health Action Plan. My main job is as a GP, working in a rural town, and I spend a lot of time doing that job, but I also spend a lot of time in my local hospital providing care there. And I think that's what sets rural doctors apart from their metropolitan counterparts, is that as GPs, we work across both the federally funded general practice and the state-funded hospital system. So I admit patients to my local hospital. I look after them as medical patients. I look after the emergency department when I'm on call for that. And I also deliver obstetric services as well when they're available. So without GPs in small country hospitals, these hospitals don't function. Videos don't quite replace a GP on the ground. So GPs in rural areas are the backbone of the rural health system. It's an incredibly rewarding career. It's incredibly valued and valuable, and I feel very honoured to be able to work as a rural GP for my community. But there are fewer and fewer GPs who are actually wanting to do this job, and they're leaving, or they're just not coming in the first place. And what's the consequence of this? It's actually quite simple. Patients just wait longer. You talk about having 2 or 3 weeks to wait. If you want an appointment with me for a non-urgent thing, it's 3 months. And this is for, and people are bearing the brunt of that across communities right across Australia, not just in New South Wales. So chronic conditions go unmanaged, and they often surface later down the track with sometimes disastrous consequences. And this brings to mind a patient I saw a year or so ago who I used to see regularly, every 6 months. But because I'd been there longer and longer and my appointments got further and further apart, I realised it had been over 12 months since I'd seen her. And I actually called her in when she'd rung up to get a script to keep her things going. I thought, I haven't seen this lady for a while. I'd better bring her in and see how she is. She was in florid heart failure. I had to admit her to my local hospital for a week. So she took up a bed for a week when I could have managed this without even needing a hospital admission. So this is preventable. What's worse, I referred her to the specialist to get a few things sorted out. She came back again another 6 or so months later, this time even more unwell, needed to be admitted to hospital and then taken on a helicopter ride out to ICU where she spent 10 days. So neither is that satisfactory for her nor for the budget of New South Wales Health. And that's purely because her access to me was reduced and the access to specialist services was reduced. These are real world stories and they're not good enough. So the New South Wales government spends a lot of money on training rural generalists like me. So why are there so few GPs wanting to work rurally? Why are they leaving? Highly skilled rural GPs are leaving because their advanced skills aren't recognised in the New South Wales system. They're not being paid with the appropriate industrial frameworks. There is no clear pathway to employ or remunerate them properly for the skills that they have. So they're going interstate. And this is happening. We've got the drain of our trainees going to work in other states. There are some rural GPs waiting 12 months for hospital contracts to be approved so they can provide care in those hospitals. There are communities where willing GP obstetricians and GP anaesthetists are not even offered hospital contracts due to administrative infighting. I look after women who travel over 2 hours just for their antenatal care, let alone to give birth. And they have their babies by the side of the road, as you've heard. And they drive past sites where they used to give birth to come and see me for their antenatal care. In New South Wales, millions of dollars have recently been allocated to cut surgical waiting lists, but we have local operating theatres in towns like mine sitting idle or underused because current funding does not support greater use of the smaller hospitals. GP anaesthetists are trained to provide their skills, but without enough theatre time, they can't practice locally, they can't maintain their skills, so they leave, or they decide not to come in the first place. So we lose a GP anaesthetist, we lose surgical services, we lose a GP for the town. In the last 10 years in my practice, I've had registrars coming regularly, and I've lost 3 GP proceduralists because we couldn't provide them with the ability to use their skills. 2 GP obstetric trainees and 1 GP anaesthetist. And that's from my town alone. And they went elsewhere because I couldn't offer them what they needed. What sets rural health care apart is the interface between general practice and the hospital system. So GPs with additional skills must be supported to work across both. So it does involve the state government. Primary care in rural areas does involve the state government, whether you like it or not. When primary care is under-resourced, hospitals bear the burden. Patients present later and sicker, and they're more complex. This is not just about small-town misfortune. This is complete system inefficiency. Patients who should be treated locally are instead transferred or delayed or managed elsewhere at far greater cost. The hospital system must be funded appropriately to train, to employ, to retain these GPs, allied health, nursing staff who work alongside them, and then rural communities will benefit. Understanding the interplay between general practice, hospital care, maternity and surgical services, and workforce training is critical. Ensuring that the pipeline from training through to a fulfilling long-term career in rural New South Wales is integrated and funded appropriately is how we begin to address rural health inequity. And then we will enhance primary care in New South Wales. Thank you.
Thanks so much, Rachel, and I think that was a really helpful way of highlighting the importance of primary care in rural and regional communities. It's not to say that virtual care and the telehealth systems don't have a role. We know that, and the communities I speak to completely acknowledge that. They just want face-to-face in-town services, at least during the day, because that's important to their community. So we're not saying no virtual care, but we're saying it shouldn't hollow out the services that we have. We want our practitioners, nurses, allied health and paramedics to work at the top of their scope of practice. Can I just say that the previous government increased incentives. This government has increased incentives for rural health workforce, and I acknowledge that. There is a good pipeline of rural generalists now there, but we just need to make sure that we have the settings in place for them to practice in our communities. That's the missing part of this puzzle, and that's why we're putting so much pressure on it. It's not the old-fashioned model of care. It's a new model of care, but it's one that doesn't leave communities without face-to-face services. So that's, I guess that's a little bit from me, but at this point I want to welcome, I think, Sarah Mitchell, who's the opposition spokesperson on health, rural health and mental health, to say a few words before closing with the Minister. Thank you.
Thanks, Joe. Thanks, everyone. Good afternoon. I just wanted to say the upper house, we still have that tension between the upper and lower house in this building for people who've been here before. We've got question time at the moment, but I've ducked out, as has Amanda Conn, because we wanted to make sure that we were here to show our support for Joe and for the event. Can I say, in my perspective, obviously I've been the Shadow Minister for Health, Regional Health and Mental Health since January, and one of the first meetings I had was actually sitting down with Joe and going through this plan to really understand the work that he's done. And he's preaching to the converted, and I think everyone here in this room, many of you I know, I've worked with in other capacities, we all want the same thing, which is better outcomes for people in regional New South Wales when it comes to our health. I live in Gunnedah, born and raised, still live there now, raising my family. So for me, having that focus on rural and regional health isn't an afterthought. It's my core reason for being in Parliament, to make sure that we have great services in our local communities. There's a lot that we could talk about. I wholeheartedly endorse the comments made by Jen and Rachel and others. And I think for me, it's that lived experience that I have, not as a politician, but actually as a mum living in a country town. You know, I had both of my babies at Gunnedah Hospital. One was an emergency Caesar, and I remind her of that every birthday after a very long labour. But I could do that in Gunnedah. That would probably not happen anymore. I might end up in Tamworth if I'm lucky. I could end up further afield. And that's the lived reality with a lot of people in our community who are going through that stage of life where they're looking to grow or expand their family, and they're worried about it. They're worried about what that will look like for them. Picking up Rachel's point, I know what it's like to wait months to try to get a routine doctor's appointment. These are the things that we deal with in our communities, but it doesn't have to be that way. And can I say, this isn't about a political point scoring. I'm not interested in that. I want outcomes, and I think all of us in this room can work together to achieve that. I want to acknowledge Ryan. I think he is very invested in this, and him being here in support, I think, speaks a lot. The best way we get things done in this place is when we work together and leave the politics at the door, and that's what I want to do in this role. I want to make sure that we're supporting our rural and regional communities. We've got the ideas, we know what we need to do, we've just got to get on and do it. Backing Joe's plan, I think, is a good step in the right direction, and I'm happy to work with anybody and everybody on behalf of my colleagues in the Liberals and Nationals to get what we need for our communities, and that's what I'll do. So thank you, thanks for letting me be here.
Thank you, Sarah. Thank you, Sarah. And just before I do call the Minister, Dr. Conn is here as the opposition spokesperson for the Greens, and as I'd like her to just speak briefly before I introduce the Minister. Thanks.
Thanks, Joe, and thank you in particular for bringing together such a terrific group of people today. This is the kind of event that's bringing people together across party lines to talk about the issues we actually should be dealing with, and it's a real pleasure to be here and part of it. I was a GP practicing in Albury before I was elected, and my partner is a nurse at our local emergency department-based hospital. And a funny thing happens in this job where constituents meet with me to tell me their horror stories, that they gave birth on the side of the road, that they waited for 12 hours in emergency, that a family member turned down care because they weren't willing to make the trip. And I don't have the reaction they expect me to. I'm supposed to look shocked and horrified. And I don't look shocked and horrified in those meetings because those are the stories I expect to hear. I've worked in the system and I know how broken it is. And frankly, if the system worked really well and rural people had terrific health equity, I'd probably still be practicing as a GP in Albury and not in here trying to make change. And I think if I can just pick out one thing of Joe's 6-point plan to comment on, because it's topical this week, I know we'll be debating your bill about primary health care access this week. Living in Albury Wodonga, I'm furious with buck passing between the New South Wales and Victorian government, but I'm even more furious about buck passing between state and federal governments. Primary care is so essential. We know that having access to a regular GP, that continuity of care, that relationship, makes people live longer, reduces hospitalisation, improves quality of life. This is so essential to the health system, and this idea that it's only the responsibility of one level of government's just a furphy. I mean, we've got local government here because they know and they understand their responsibility to communities, especially in the bush. So I'm really grateful that we have the opportunity to debate, whether or not the state government should actually take on more of a leadership role in ensuring access to primary care, and certainly on behalf of the Greens, that's something we'll be supporting. So thanks, Joe.
Okay, thank you very much, Amanda. And now it gives me great pleasure to introduce the Health Minister, Ryan. Many people have spoken positively about Ryan, and I echo those sentiments. He's been very committed to this area, and there have been improvements that I acknowledge in rural health. It's just that we've got a long way to go, and so that's why I've developed this plan to put that pressure on the system today. But I do want to acknowledge the work that the Minister's done. And actually, Minister, thank you very much for coming and saying a few words this morning. Thank you.
Thank you, Joe, and I certainly wasn't going to miss this. Can I acknowledge the land on which we gather and the traditional owners of that land, pay my respects to elders past, present and emerging, and acknowledge traditional owners from where you have come from. Can I just acknowledge all of my parliamentary colleagues, the Shadow Minister, Sarah Mitchell, who's had a long-term interest and advocacy on health, not just as the Shadow Minister, to be frank, but also during her time working with Bronnie Taylor as the Minister for Regional Health in the last government. Was also a strong advocate. Every single member of Parliament who's here, both upper house and lower house, are tremendous advocates for regional, rural and remote healthcare. And I know that because I've met with all of them. I've travelled with many of them. I've visited many of them. They've been in my office. I've been in theirs. I've had many phone calls. I've had many meetings. I've had many discussions with them. And it's not my place to judge other members of Parliament. But let me assure all of the community members and stakeholders who are here, the men and women who are here today, and there are others who can't make it today, are tremendous advocates for regional, rural and remote health, regardless of their political affiliations. And I think that is the most important thing that, from me as a minister, I want to make very clear today, because that is particularly important and it is something that is not lost on me. I asked to have this portfolio. I didn't want it separated. I wanted to have regional, rural and remote healthcare. It remains a significant amount of unfinished business. You won't ever hear me say that the job is done. I won't say it inside my own government and certainly won't say it publicly. I'm a person from Wollongong, so I suppose you call that a large regional centre. We will certainly not call it Sydney. But I do want to emphasise a few things, and I want to firstly acknowledge Joe. Joe has been a tremendous advocate for regional, rural and remote healthcare from the day he walked into this place and in his professional life and career. I've met with him many times. As I said, all of the members here are here today. But people often ask me, and I had a school child ask me just the other day in my own electorate, what's the best skills about being a local member? And I said, you got to believe in things. You got to believe in things. And Joe believes deeply in healthcare for the bush. And people who believe in things, I've got a natural affinity for, because they're, as my mum says, the sort of people you should hang around. and they mean a lot to me. So firstly, Joe, I want to thank you for your tremendous advocacy over a long period of time. We are working through some pretty big challenges. If I had my way, I would take primary care in totality. I would not want a two-funded health system in this country. If I had my way, it would be delivered and funded directly to the states, because you are right in acknowledging that some of the challenges exist between two levels of government, and people are right in saying it annoys them when there is buck passing. I get that. I get annoyed with it, and I'm on the inside. It frustrates me. But the reality of our health agreement and funding agreement, although attempted some years ago to try and do it through the states, is one that is jointly funded. That's not an excuse, and don't want you to think that it is, nor am I here, as Sarah said, rightly said, to criticise any form of government for this. That's not the case. But the two-funded health system is a real challenge for a health minister in the largest state, delivering services so far away and in very remote areas. Very different to, say, Victoria. Very, very different. Very different even to Queensland in a lot of ways, because we've got very large populations spread very far distances away. Very different to other parts of this country and certainly other parts of the world. So we have tried to work with the Commonwealth Government, but primary care remains a big challenge for us because, yes, we have to be part of the primary care solution. I'm not saying that we should be out of it. The reality is we already spend millions of dollars on primary care. That's what we do. But it is a responsibility of the Commonwealth to live it. Most importantly, it's where the funding flows to it. So we have to work with them on that. And I remain committed to work with anyone in Canberra on this, and I think I can speak for the Coalition and the crossbench in saying that regardless of who's in Canberra, we have a responsibility here in a two-funded system to get the best deal for New South Wales, and in particular regional and rural communities. Now, getting that deal is a challenge, one of the big challenges we now face in our hospitals, and it's exacerbated the further you get away from here, is very large numbers of elderly and NDIS patients taking up acute beds in our hospitals. I say that because it's not a finger-blaming issue at all. It's just if you walk through the life of that patient doesn't really give a toss who's doing the funding. But when you're stuck in a hospital bed for 62 days because you can't get access to an aged care bed or you can't get access to NDIS support or home care support, that puts pressure on your local hospital. Whether we like that or not, it does. And when it's a regional and rural hospital, it is more so proportionally because the bed base is not as large. Now that is something that we have had very strong and robust arguments both privately and publicly about and will continue to do. We are committed in terms of the workforce. I can report we've seen a growth of the regional and rural workforce by about 5,000. That's about 5.7%. That is not to say in any way, shape or form we don't have challenges in workforce. Apart from older people stuck in our hospitals and NDIS patients stuck in our hospitals, workforce remains the biggest challenge facing me as the health minister, and it's what keeps me up at night. We have relatively high retention rates in regional and rural areas at around 90%, but there are gaps, and some of those gaps have been already discussed, particularly in specialties and particularly in maternity and birthing services. I do want to talk a little bit about that, and I want to let everybody know this. I have a philosophical view that people should birth as close to where they live as they possibly can. That may not always be something that Sydney-siders are passionate about, but the further you get away from here, it is important. Like Sarah's story about Gunnedah, I'm born and bred in Wollongong and was born in that hospital. That is something that I'm proud of. And I know, having spoken to many regional and rural members and communities directly, the further you get away from this place, your birthplace is very important. It's also very important for Aboriginal people. So my edict to New South Wales Health has been a simple one. I want to make sure that wherever we can, we want to try and have birthing services, antenatal, postnatal services as close to home as we possibly can. Now, I understand, and most people acknowledge, that across the globe at the moment we have a shortage of midwives. That is the challenge. It's not an excuse, it is a challenge. One end is real. There was recent research on it in the Northern Hemisphere about this. This is not unique to New South Wales. That remains a challenge, but we have managed to open regional MGPs at Cooma, Glen Innes, Port Macquarie, Goulburn, Shoalhaven, Maruya and Wagga Wagga. They are good. That doesn't necessarily mean the problem is solved even in those areas, because they aren't necessarily birthing services. And I want to acknowledge the difference and don't want people to think that I'm taking away from that. We are committed, and I know the Coalition was similarly committed in relation to the work that Bronnie Taylor did to roll out additional midwives specifically for the bush. Now we've got up to, or we're rolling out over the next couple of years, 53 regional and rural midwives, all designed to try and increase services and birthing services, which I know is fundamental to Joe's plan and your views in regional and rural areas. And I'll end by saying this, I will work with anyone and engage with anyone to try and improve health services in regional, rural and remote areas. Do they keep me up at night? You bloody bet they do. Absolutely they do. Because having spoken to many, many people, having spoken to many, many practitioners, many advocacy groups who are here today, I understand how important they are. They're important not just for the delivery of health services, but to be quite honest, they're important to economies of regional towns. They're important to communities and the way in which communities function. I know in my own community, healthcare, people would think coming from Wollongong, it's a place full of steelworkers and miners. It's actually not. Our largest employer probably now is the health service. That is also the case out in regional, rural and remote areas. So we remain very committed. We do not think in any way, shape or form the job is done. That is not my approach, never will be my approach to any particular part of my portfolio while I'm the Minister. We remain dedicated to trying to continue to improve services for the bush, to working with you and stakeholders and local MPs and members of the other place about doing that, and that is something that you have my absolute commitment on, and thank you for being in the oldest parliament and the most important one.
Thanks, Minister. Thank you very much, and you've been here from the start, so thank you for staying and listening to those the presentations here today. That was fantastic. Can I just acknowledge before I close the members for Upper Hunter, Kempsey, who are here, and the Minister and member for Port Stephens, Kate Washington's here, so Dave Lozelle and Michael Kemp. And I hope I've acknowledged, I hope I've acknowledged all the MPs. I don't want to offend any of my colleagues, but I do appreciate those who've made an effort to attend. But I do want to thank all of those people who've travelled today from right across the state who've come down here to be here and to present. I particularly want to thank Danica and Rachel and Jen for talking, but I actually do want to also acknowledge all of you here. I think it's just really important that we have so many people from so many different organisations who've come to the Parliament to let the MPs and the Minister know just how important this issue is. So I really, from the bottom of my heart, thank you for making that effort today. Look, those presentations really nailed the issues. Thank you so much for doing those. I think the stories were really personal. I think we all get how important this is. As the Minister said, it's important for our economies, it's important for our communities, it's important for our families. So we just need to keep the pressure going. It's a big system. I think there is political will, but we have to get the system to address that. And it's a big bureaucracy. It's hard to shift. We're not asking it to do cartwheels, but we are asking it to re-establish some maternity services. We are asking it to make sure that there are positions for midwives and rural generalists. We are asking it to listen to communities. We do want it accountable through a Rural Health Commissioner. And we do want to stop to fly-in, fly-out services, providing the main services. We want our own health professionals on the ground. Are those easy? No, they're probably not. Will the system naturally tackle those issues? No, it won't, because it just will default to what it does. That's why we need this pressure. It isn't over. We've got to keep going. We've got an election in March, and I want to make sure that rural and regional health is a priority and there are commitments to it in that election so that we can get outcomes for our remote, rural and regional people. So once again, thank you, and we'll end the session there. The bells are going, and hang around, and I hope you can mingle as well. Thank you very much. Right. Jen, thanks so much. That was great. You did a great presentation. That'd be great. That'd be great. Thanks for that. It just live. And that was Good, excellent. Nice to meet you.